Well, we can't really talk about the toxicity of aspirin unless we bring in this whole concept of cox-1 and cox-2. So we have to talk about it. The best way to understand cox-1 and cox-2 inhibition is to realize that aspirin and other NSAIDs inhibit both cox-1 and cox-2. And cox-1 is cyclooxygenase 1 and cox-2 is cyclooxygenase 2. Aspirin inhibits both. Well, that's really nice, especially in the inhibition of cyclooxygenase 2, because in the inhibition of cyclooxygenase 2 or cox-2, that's primarily the decreasing the prostacyclin and the anti-inflammatory effects of aspirin and some of the antipyretic effects as well. The problem is in the inhibition of cyclooxygenase 1 or cox-1, you were looking at the biochemistry of things which will normally affect platelets and gastric mucosa as well. And that's why patients that take aspirin often have coagulation problems because of the thromboxane A2, or the fact that there's a lot of gastric bleeding because of the fact that there's gastroprotective prostaglandins that are being interfered with. So the multi-billion-dollar industry that has developed in the last generation or so has been the specific inhibition of cyclooxygenase 2. And that's why you could take aspirin, which is, less than a penny a pill, and all of a sudden charge, $1 a pill now because of specific cox-2 inhibition. Let's look at the biochemistry chart of this whole thing. You have arachidonic acid here. It is formed by the action of enzymes called phospholipases from the breakdown of cell membranes. Okay, steroids inhibit this process by inhibiting the formation of arachidonic acid by phospholipases. Once you have arachidonic acid, however, you then have your arachidonic acid derivatives. There's basically four groups. There's the leukotrienes and there's the lipoxins. For arachidonic acid to form into leukotrienes and lipoxins, you need the action of the lipoxygenases. For arachidonic acid to form into the prostaglandins, the prostacyclin, and the thromboxanes, you need the cyclooxygenases, in other words, cox-1 and cox-2. So let's go back to our little chart here and say that if you could specifically inhibit cox-2 without inhibiting cox-1, you'll take away most of the bad effects of aspirin. And that's how I look at it. So let's move down now from the personal exposures to the medications to the types of exposures we call indoor air pollution. We won't really talk in detail about too much of this, but you should remember that carbon monoxide can build up indoors. Nitrogen dioxide could build up indoors, not just in industrial settings. Wood smoke, a lot of people still burn wood in their homes. You could have the formation of formaldehyde. I think any pathologist can give you a 10-hour lecture on that. Things like radon, radioactive but inert gases, bioaerosols, tiny little particles that carry a wide variety of pathogens, as well as manufactured mineral fibers. These are all things that contribute to toxicity in the air that we breathe indoors. And let's talk about the one of most significant concern and the one that has the most known and proven effect on lung cancers, and that's radon. It's in the series of atoms on the periodic chart that just love to take up the one additional electron. It's the heaviest one. It's radioactive. It's a decay product of uranium. It's widely distributed in the soil, and it's present in a lot of the basements of homes, older homes. And it's present in the basements because, being a heavy gas, it tends to actually sink towards the floor and the lower floors. The radon decay products are alpha emitters. which are two protons, two neutrons, and even though they are relatively low energy and low penetration, they do tremendous amounts of tissue damage. And they probably do enough to actually wind up causing mutations in genes, which are protective from cancers. So the statistics are, about 10% of U.S. homes have levels of radon associated with an increased risk of lung cancer. And statistically, if you look back, radon causes about 10,000 lung cancers per year. Not nearly as much, perhaps 1/10 or 1/20 as much as tobacco, but it's a significant amount. So basically, the general principle is to have proper ventilation. Make sure there are radon detectors for houses, but proper ventilation is the best way to keep radon from doing its bad effect. Let's talk about lead. Lead is a heavy metal. The body is often fooled into thinking that it's calcium. In the non-industrial setting, the lead exposure, some lead paint, perhaps lead solder in plumbing. In the older houses, we didn't have PVC, we had lead. Some of the ceramics are lead glazed. And of course, there's the industrial exposure, which the average person doesn't have to worry about. Lead can be ingested if some of these lead paint chips are ingested, or they could be inhaled in industrial exposures. It's a divalent cation, like calcium. It's taken up by bones, especially growing bones and teeth. And the body is fooled into thinking that lead is calcium because it reacts much in the same way that it does. Once lead gets into a bone, the turnover rate is extremely slow. So of all the lead that is in our bones right now, we're still going to have half of that in 30 years. Blood accumulates in 5 to 10% of lead, but lead is rapidly cleared from the blood. Nevertheless, lead has a distinct effect on the formation of red blood cells. Most of the lead in our body that's not in the bone or the small amounts of blood is distributed in soft tissues, and eventually it can be excreted from the kidneys. So that's the compartmental analysis of lead. Let's talk about the bad effects of lead. Well, lead biochemically has a high affinity for sulfhydryl groups, and that's going to result in having some of the red blood cell toxic effects of lead, where we see basophilic stippling of erythrocytes and resulting in a hypochromic type of anemia. Lead chemically competes with calcium ions as a divalent cation, and therefore it can accumulate in bone. It's also involved with neurotoxicity because of the importance of calcium in nerve transmission. And lead inhibits a lot of the membrane-associated enzymes, like 5' nucleotidase, and therefore it's going to result in decreased survival of red cells and therefore hemolysis as a hemolytic type of anemia, renal damage, and even hypertension. Here's a nice little diagram showing some of the places where we talk about lead doing its effect. You can have lead lines in the gingiva as a observation of the mucosa itself, or you can have lead lines as a radiologic observation near the epiphyses of bones in growing kids. You can have a toxic effect of anemia type effect in the blood with red cell stippling. You can have kidney disease, gastrointestinal tract disease, and a lot of central nervous system effects due to the fact that lead behaves like calcium, and it interferes with nerve transmission. Let's look at some of these things in the lab and in the patients and in the X-ray lab, and we'll have to do this in the next clip. We'll talk about some of the observable effects of lead toxicity. Thank you very much.